Clots are becoming more common in some COVID-19 patients. Doctors are finding them in every part of the body, from legs to kidneys, the lungs, and even the brain. Matt DeLucia looks into why this is happening.
I am seeing a higher rate of what we call venous thromboembolism, blood clots, either in the legs or in the lungs or elsewhere. And I'm encountering it way more than I would typically encounter it in a similar patient population.
Dr. Rick Pescator is an emergency physician. He's used to seeing pretty much everything in the ER, but COVID-19 continues to offer new lessons.
Here's how blood clots work. If I get it cut, clotting is the body's natural response to stop the bleeding and form a scab. But if that happens abruptly in a vein or an artery, that can cause a blockage and be life-threatening.
We have autopsy studies now that are showing microthrombi, tiny, very small clots that are found diffusely throughout the lungs and even in the brain as well.
A study by MIT found more than 70% of people killed by COVID-19 had clots blocking small blood vessels.
This viral infection is so intense that it not only inflames certain parts of the organ like the lung tissue, but the lung blood vessels and blood vessels throughout the body, including the kidney and the heart and the venous system in your legs and your arms. So even arterial clots can occur, which is rare to see with infections overall.
Dr. Gerard Kreiner has also been seeing more cases of blood clots at Temple University Hospital, leading him in some cases to use medication proactively.
What we will do is that we will anticoagulate people much more aggressively than we did in the past, and in some cases we'll fully anticoagulate the patient with blood thinners just to decrease the complications of clotting.
The FDA says more needs to be done to stop people from drinking hand sanitizer. The National Poison Data System reported a 79% spike compared to this time last year. The majority of those calls were for unintentional exposures in children 5 and younger. The FDA wants manufacturers to add denatured alcohol, which renders a bitter taste, so it's less appealing to ingest.